So the question is, I really don't know whether I need implants or not because I had some part of my jaw removed for a medical condition, and the jawbone that I had removed was replaced with some bone from my leg, and I need some expert advice on whether I need implants or not. So to answer your question, if you have any missing teeth, and if you're suffering because of the missing teeth and you're not able to either wear the denture properly, or you're having some problems with the chewing or able to function properly because of, despite having a good set of teeth, then definitely you need implants. So the bottom line is the implants are going to help you replace your teeth, and the most important thing about the implants are the closest replacement to the natural teeth. They are going to look, feel, and function like a natural teeth. And if you happen to wear a denture, and implants can help secure the denture in place. So to go back to your question, can you have implants despite having part of your jawbone reconstructed with the bone from your leg? Yes, you can. So who can be the best expert to replace or fix your jawbone with some implants to secure some good teeth or secure the denture that you might have? The best recommendation is you go see the reconstructive surgeon, whoever did the implant. So they will be the best people. Either more than likely they are able to do the implant themselves. For example, I know a lot of oral maxillofacial surgeons who are reconstructive surgeons. They're able to do the reconstruction for any type of problems that you're describing, the part of the jawbone being removed and bone being taken from the leg, and do the reconstruction. Not only they do those type of reconstruction, after your bone becomes stabilized and they are now able to go back and put those implants also to reconstruct either your teeth or to secure your denture. So my recommendation is the best experts that you should go see are the reconstructive surgeon to begin with, and either they can do the implants for you, or if they are not able to do that for you, they should be able to recommend somebody locally or they work with to be able to get those implants done for you.